The highlight of the symposium on continuous glucose monitoring certainly were very promising results in patients with both type 1 and type 2 diabetes on the benefit that continuous glucose monitoring provides in these patient populations. We had good data before that patients with type 1 diabetes on insulin pumps benefit from continuous glucose monitoring. But there, for the first time, we saw data now that patients also with multiple daily injections, so on a basal bolus regimen, benefit with regards to HbA1c, with regards to hypoglycemia, and also with regards to quality of life. And that, I think, is really reassuring. And there were similar data at least with regard to HbA1c in people with type 2 diabetes. I think in the near future it's very clear that while we will have new pharmaceutical agents that will help improve the treatment of diabetes, in the near future I think the real breakthrough will be diabetes technology. We have seen more and more data with increasing accuracy and precision of the continuous glucose monitors, in the symposium there was an outlook on the developments to come with even smaller devices, with devices that don't need calibration or need calibration once per day and which will last for 14 days. And these devices, in combination with good algorithms and a closed loop system, I think will really help patients to achieve good glycemic control without hypoglycemia and without being bothered too much by their daily treatment of diabetes. I think it will be very important for us as diabetologists to really fight for those improvements that make a difference in the life and in the treatment of our patients. And I think diabetes technology and continuous glucose monitoring in particular is something that we need to fight for. There are so many patients that will benefit from these technologies if they use it. It's very evident from all the data we have that people with type 1 diabetes on both pumps or on basal bolus regimen, and even people with type 2 diabetes will benefit if they regularly use these devices. And they will benefit with regard to glycemic control, and particularly the patients with type 1 also with regard to hypoglycemia and quality of life. They will reduce the number of finger sticks, and I really would encourage everybody to fight in their country for reimbursement. I think it's very important that we tell authorities and healthcare providers this is something we really need and will make a difference to our patients' life. So the data I presented on Monday were basically two studies that were done in people, mainly in people with type 1 diabetes. So before we had data that people with type 1 diabetes on insulin pumps benefit from continuous glucose monitoring. But the data on the majority of patients that are treated with basal bolus regimen on the benefit of CGM was really scarce. So we now have two studies that very consistently show improvements in HbA1c, but in a magnitude of 0.4 to 0.6%, which I think is really relevant. And at the same time, they not only improve glycemic control, but also the time spent in hypoglycemia and in hyperglycemia is reduced. And that, of course, is quite important for daily patients' treatment. And so it might not be surprising that these patients had an improvement in treatment satisfaction and in quality of life. At the same time, they also could reduce the number of self-blood glucose measurements by at least 1 or 2 measurements per day, which I think is really important. And these data were very consistent in the two studies, the GOLD study and the DIAMOND study. So I think this is very important, of course, for scientists that you see data that then could be replicated in another study. But the DIAMOND study also had an arm in people with type 2 diabetes. And they benefited again from CGM with regard to HbA1c, a reduction by about 0.3%. But the good news is that those who had high baseline HbA1c levels had even higher improvements in HbA1c with CGM. So also these people will benefit from continuous glucose monitoring.